Non-Hodgkin lymphoma classification. It's of two types, arising from T cell and B cell. T cell. 1. Precursor T cell. 2. Mature T cell. B cell. 1. Precursor B cell. 2. Pre-germinal center. 3. Centroblast. 4. Centrocytes. 5. Post-germinal center. 6. Plasmoblast. NHL arising from T cell. 1. Precursor T cell lymphoma. 2. Mature T cell lymphoma. NHL arising from B cell. 1. Precursor B cell, all. 2. Pre-germinal center, MCL. 3. Centroblast, DLBCL plus Burkitt's. 4. Centrocytes, follicular lymphoma. 5. Post-germinal center, MZL. 6. Plasmoblast ABCDLBCL. Most common NHL. DLBCL. Examples of mature T-cell lymphoma. 1. Aplastic large cell lymphoma. 2. Angioimmunoblastic lymphoma. 3. Celiac associated. 4. Mycosis fungoides cutaneous associated. 5. Extranodal NKT lymphoma. 6. HTLV1 associated. 7. Hepatospelnic T-cell. Mycosis fungoides mature T-cell lymphoma is aka Sézary syndrome. Aplastic large cell lymphoma CD marker and translocation. CD30 ALK. T2, 5. Aplastic large cell lymphoma specific cells associated with it. Hallmark cells. It's associated with breast implants too. Which of the NHL are low grade? 1. SLL. 2. MZL. 3. Follicular lymphoma. Which of the NHL are high grade? DLBCL. Burkitt's. Which lymphoma are associated with HIV? DLBCL. Burkitt's. Which lymphoma are associated with HCV? 1. Waldenstrom macroglobulinemia. 2. Splenic MZL. Which lymphoma are associated with H. pylori? Maltoma extranodal MZL. Which lymphoma are associated with HHV8? Primary effusion lymphoma, Castleman disease. Which lymphoma are associated with HTLV1? Adult T-cell lymphoma. Which lymphoma are associated with EBV? 1. Hodgkin disease. 2. Burkitt's. 3. Post-organ transplant lymphoma. 4. Primary CNS lymphoma. 5. Extranodal NKT lymphoma. Staging of lymphoma. Ann Arbor staging. Stage 1 single lane. Stage 2 to 2 or more nodes on single side of diaphragm. Stage 3 nodes on both side of diaphragm. Stage 4 diffuse extralymphatic involvement. Stage 2 of Ann Arbor is considered early disease but termed unfavorable when age greater than 60, high LDH, greater than 1 extranodal site, poor performance status. General features of non-Hodgkin lymphoma. 1. Age, 60 year. 2. Asymptomatic painless lymphadenopathy. 3. Supraclavicular nodes MC. 4. Extranodal sites involved GIT MC. 5. B symptoms rare. 6. CNS involved, rare. Mantle cell lymphoma associated translocation. Types. T11, 14. Types. SOX11 positive, SOX11 negative. Mantle cell lymphoma is considered aggressive. Why? Because 1. Extranodal involvement, GIT, marrow, blood, spleen. 2. Unresponsive to standard R-CHOP therapy. Follicular lymphoma markers and translocation. CD10, 23. BCL6 dysregulation. Aberrant BCL2 expression. T14, 18. Histology in follicular lymphoma. Follicular pattern paratrabecular lymphoid aggregate with small cleaved cells and large non-cleaved cells. What's main concern with follicular lymphoma? Its relapse or spontaneous remission is common. What's the most common type of MZL? Maltoma purely extranodal. CD markers and translocation for maltoma. CD5, 10, 23 negative. T, 11, 18. Clinical features and treatment of maltoma. Upper GI symptoms. Treatment, H. pylori eradication, if no response, R-CHOP. MZL associated with what syndrome involves salivary gland? Sjogren syndrome. Features of high-grade lymphoma. 1. Rapidly progressive painless lymphadenopathy, causes compression symptoms. 2. Extensive B symptoms. 3. Extranodal involvement. 4. No bone marrow, CNS involvement. 5. LDH and hypoalbuminemia are bad prognostic. Which type of NHL has female predominance? Maltoma cause of associated autoimmune factor. Types of DLBCL and prognosis. 1. Germinal center good. 2. Activated B-cell DLBCL, ABC-DLBCL bad. Markers for germinal center type DLBCL and ABC-DLBCL. CD10 plus for germinal center. CD10, MUM1 plus, for ABC-DLBCL. Presentation of ABC-DLBCL. CNS lymphoma, mediastinal lymphoma, organ transplant lymphoma, body cavity lymphoma. It's also a HIV-defining illness. BCL2 and BCL6 status in DLBCL. BCL6 dysregulation greater than. Aberrant BCL2 expression. T, 14, 18. What's double hit and triple hit? Doubt hit CMYC rearrangement plus rearrangement of BCL2 or BCL6. Triple hit, CMYC rearrangement plus rearrangement of BCL2 and BCL6. Double expressor lymphoma is seen in ABC-DLBCL. Treatment of NHL. R-CHOP regimen, rituximab, cyclophosphamide, hydroxydonorubicin, oncovirin, prednisolone. Which is the childhood lymphoma? Burkitt's. Markers for Burkitt's. CD10, BCL6 positive. Can Burkitt's involve CNS? And how does it respond to chemo? It's chemosensitive and yes can involve CNS. Pathophysiology of Burkitt. CMYC dysregulation on 8th chromosome. So high level of MYC protein. Chromosomal translocations in Burkitt's. T8, 14 MC. T8, 2. T8, 22. Highest proliferative index among all NHL is of Burkitt's high key 67 value. Types of Burkitt's. 1. Endemic, EBV+. 2. Sporadic EBV. 3. HIV associated. Tumor mass is seen at what location in endemic and sporadic Burkitt's? Endemic, jaw, sporadic, abdominal. Treatment of Burkitt's. CODOXM or IVAC regime. Don't respond to R-CHOP. Histopathology feature of Burkitt's. Starry sky appearance, star macrophages, sky tumor cell. Lymphoma with bone marrow involvement. Burkitt's, mantle cell lymphoma, DLBCL.